So firstly, to introduce myself, my name is Debbie and I joined Myeloma UK as a Myeloma Information Specialist in June this year. Prior to this, I worked with myeloma patients in a variety of nursing roles within the NHS. My primary role here at Myeloma UK is to take calls on the info line and to reply to Ask the Nurse emails. Here on the info line, many of the calls we receive highlight the importance of the relationship between patients, their families and the healthcare team. And given the complex and relapsing remitting nature of myeloma, we know that patient relationships with healthcare professionals will often span many years. So in today's webinar, we will present some strategies for potentially improving these relationships. Much can potentially be gained when relationships are good, including better communication, better care as a result of improved communication, less stress for everyone involved, and a better use of everyone's time, leading to improved satisfaction for all parties. Although the haematologist and clinical nurse specialists may be the key contacts in your team, you may also have long-standing relationships with other multidisciplinary team members. For example, renal consultants who are kidney specialists, or the palliative care team who provide supportive care such as pain control. During this webinar, we will focus on strategies in three key areas. First, we will look at some suggestions for how to make the most of your appointments. Then we will consider some practical advice for improving relationships. And finally, we will provide an overview of when to ask for a second opinion and how to get it. So, how to make the most of your appointments? As you will no doubt have experienced firsthand, time in clinic seeing the haematologist, the clinical nurse specialist or any other team members can feel like it passes extremely quickly. And sometimes you don't get the opportunity to discuss all the matters on your mind. In order to make the most of the time you have, it can be helpful to dedicate some time, both generally and before each of your appointments, to prepare. With regard to general preparation, developing a basic understanding of myeloma and the reasons for any symptoms you might be experiencing can go a long way to aid clear communication with your team. By Be Informed, I'm not suggesting that you need to become an expert. Myeloma is a very complex cancer. However, developing a basic understanding of myeloma and its characteristics, particularly those that might be affecting you, and learning about the potential side effects of the treatment that you are receiving can be a great help. Healthcare professionals understand there is a lot of information to take in during consultations, particularly when one is newly diagnosed or about to start a new treatment. Sometimes it is not possible to digest all the information you have been provided with in one consultation. So keep any written information you have been given and aim to reread it several times to consolidate your knowledge. Aside from the information provided by your team, additional information can also be found via the internet and from cancer information centres local to you. If you are using the internet, it is important to source information from reliable websites. The Myeloma UK website is one way of learning more. Here you can access multiple resources on a vast range of myeloma-related topics and in various different formats, which can help with developing your own knowledge. We will email you information on how to access these following this webinar. Some of you may also be familiar with our info line and Ask the Nurse services, where you can contact us directly here at Myeloma UK to clarify anything you are unsure of. Continuing with general preparation, we know from patient feedback to the info line that keeping a diary or a journal can also be a very useful tool. This can enable you to keep track of your thoughts, feelings, concerns and questions as they occur, as well as record your test results and treatment schedule. By keeping everything together in this way, patients have told us it helps them to clarify their thoughts in readiness for their next appointment. With this in mind, Myeloma UK have produced a specific myeloma diary which has useful sections for you to keep information and notes. More about how to order one at the end of this webinar. If you do already keep a diary or you plan to use one in the future, healthcare professionals have told us it can be very helpful to take it with you to your appointments so that you have all relevant information to hand. So moving on to preparation before each appointment. Taking a little time before each specific appointment to prepare can help ensure that you get what you need out of that interaction with your healthcare team. Having kept notes in your diary since your last appointment, you can use this information to prepare a list of questions for your doctor or nurse. Initially, write down all of your questions and then prioritise them so that the top 3 questions or matters you wish to discuss can be addressed first. If you are currently on treatment, the doctor will also want to hear about any side effects you may have experienced since your last appointment. If you have lots of questions, it is sometimes useful to consider in advance whether some of your questions can be directed to other members of the team, for example, the clinical nurse specialist or the hospital pharmacist. This way, you will potentially give yourself more time to discuss your other questions or concerns with your doctor. Please do also think about taking a partner, friend or family member along to clinic appointments. Apart from being an extra pair of ears, they can also support you by taking notes that you can look back over after the appointment. You can also ask your doctor at the end of the consultation to copy you in on correspondence between them and your GP. This can provide you with a useful summary of what you have discussed. Now, moving on to practical advice to improve relationships. As we all know, communication is a key factor in all relationships, and this is no different when engaging with your healthcare team. There are many theories surrounding principles of good communication, but considering some basic principles for your interactions with your healthcare team can be helpful. A useful tool can be to keep in mind the 7 C's when preparing for your appointments. Aim to keep your questions to the team clear and concise. Think through how you can describe your symptom or present your question in a simple and straightforward way. Try to stick to the point. Give some details but not too many. Stay focused on the key elements. This will give your doctor or nurse a concrete picture of what you are telling them. Address your questions to the appropriate healthcare professional. So, for example, a question about access to benefits might best be answered by the clinical nurse specialist or your hospital social worker. Thinking about who can best answer your questions, i.e. the best placed or correct person, can free up more time to talk with your doctor about your other questions. In a coherent and complete communication, the description or question flows. The points you wish to make are connected and relevant to the topic, and all relevant information has been provided to enable the doctor or nurse to respond. It is usually helpful to separate different topics into different questions so that your doctor can address each one in turn. Preparing your questions in advance of your appointment and thinking through how to present the key points can enable you to cover more during the consultation, which in turn can enable more time for discussion. The final C, for courteous, is a reminder to be open and honest. Being open and honest enables your doctor or nurse to provide you with the most appropriate advice and care. On occasions, it can feel difficult to describe how you are feeling. People often don't want to make a fuss or detail embarrassing side effects that they are experiencing. However, healthcare professionals are used to hearing and dealing with these things. Don't be afraid to clarify any information you are given. Reiterating key points and confirming any next steps can ensure you all have the same understanding. Being patient and polite can sometimes take a lot of effort, particularly when clinic appointments are running very late or other administrative issues occur, such as delays in drugs coming from pharmacy or hospital transport problems. And this leads to you being delayed at the hospital. At these times, and even though the healthcare professional will often share your frustration, tempers can become frayed and communication can be negatively affected. Keeping this in mind and trying to understand the limitations of the system can be helpful for all parties. If problems are arising persistently, then talk with the nurse specialist or the patient advice and liaison service about raising your concerns with the appropriate department manager. In adopting this approach, you can separate your care and your relationship with your healthcare team from any logistical or management issues. So moving on now to the matter of second opinions. A second opinion involves seeing another doctor with the aim of obtaining their view on your diagnosis and treatment. For myeloma patients, this will often mean travelling to another hospital to see another haematologist who specialises in myeloma. Here in the UK, patients do not have a legal right to a second opinion. However, doctors are usually willing to arrange this for you, and please don't be worried to ask for this. Some patients can be concerned that asking for a second opinion will upset their doctor. However, this is not usually the case, as doctors often collaborate and seek each other's opinions on complex cases. Seeking a second opinion does not mean that the new doctor will take over your care. It means that they will share their knowledge, experience and expertise with you and your current doctor. In the event you wish to transfer your care to the new doctor, this will need to be arranged subsequently. Before asking for a second opinion, it is worth considering what can potentially be gained. Potential benefits include feeling reassured that the correct diagnosis and treatment decisions have been made, receiving additional information on alternative or future treatment options, and/or having the opportunity to talk with another doctor if the relationship with your current doctor isn't as you would like it to be. Patients can ask for a second opinion at any time. However, key milestones are often a trigger for requesting a second opinion, such as at diagnosis, at relapse, or when treatment options have become limited and you may be looking to explore access to new therapies via clinical trial, for example. Obtaining a second opinion can be both reassuring and informative. To obtain a second opinion, you can make the request to your haematologist or your GP. Your current doctor will refer you and will send a comprehensive letter outlining your situation, and they will also forward on any requests from tests that you have had undertaken. You will then be contacted directly by the second hospital with an appointment. If you are wanting to obtain a second opinion prior to starting treatment, this could lead to a delay, so please do discuss this with your current doctor to find out whether a delay could affect you.
Okay, thanks very much, Debbie. I hope you all found that helpful, and we'll start taking our first questions. Okay, so our first question comes from Daniel. He says, I don't feel my healthcare team listens to me and I get very confused during consultations. Do you think they would be receptive if I took a written statement to give them to read before we begin, or would that annoy them?
Thank you, Daniel. There's quite a lot in that question. So, First of all, I'm sorry to hear that you don't feel your healthcare team is listening to you, and I wonder if you might discuss that with your nurse specialist. And I can understand that can lead you to feeling confused. With regard to taking in a written statement, perhaps what you might want to do is jot a few notes down with the key points that you want to discuss, and hopefully that will then, and give that to the team at the beginning of the consultation, and hopefully that will then give them some direction in terms of the questions or things that you want to discuss in the consultation.
Is it quite common for patients to bring in written notes during a consultation and an appointment?
Absolutely, it is common, and healthcare professionals, when I was working professionally, and doctors that I have worked with like it, because they want to address the issues that you have, and so yeah, taking in some questions or key points for discussion and handing a little note over with those jotted down can be very helpful.
Thanks very much, Debbie, and I hope that helps you, Daniel. Let us know how you get on. Okay, so our next question comes from Jackie. You mentioned the patient diary. I keep my own diary, but I don't know what to share with my doctor.
Okay, thank you, Jackie. So I think the key things that your doctor would probably be interested in hearing about from you is symptoms and side effects. So particularly if you're on treatment, they're going to want to know if you're experiencing any side effects, so that they can address that with you. And also keeping a note of your questions and any concerns that you have, so that you can then address those with the team.
Okay, so we obviously mentioned our Myeloma UK patient diary earlier on in the presentation.
Yes.
Would something like that help more than a normal diary? How does it differ compared to a normal person's notepad?
Yeah. Well, the myeloma diary does have very specific sections to help. So the symptoms and side effects and questions for asking your doctor, we have sections for recording these. But it does also enable you to record lots of other interesting and helpful information. So there is a section, for example, for blood tests and results. You can keep a note of your treatment record. And there's some other bits of information in the diary that can be very helpful. So key myeloma terms, and a note of other useful organisations. Some of the diary can be actually filled in your clinic appointments by your healthcare professionals. It's been designed with that in mind.
Okay, fab. I think our other myeloma information nurse specialist, Ellen, has said quite a few times that patients really do seem to find the patient diary helpful. Jackie, if you do want to order one, we're going to be sending out an email with a list of all the resources that you can do, so we'll be sending that out to you soon. Okay, so our next question comes from Pauline. She says, can I record a consultation on a dictaphone so I can listen back to it later, or is that not allowed?
Thank you, Pauline. Yes, I think it is allowed. However, because of data protection rules, it would be advisable to discuss it with the healthcare professional at the beginning of the consultation and to obtain their permission. Certainly when I was working clinically, I did have patients who asked if they could record, because there was a lot of information to take in, and it's a great way of being able to listen back later and sort of digest all of the detail. So most doctors and nurses, I think, would be happy for people to record the consultation, but do ask first.
Yeah, I can imagine it's a bit of a personal preference thing with the healthcare team whether or not they wish to be recorded. Do you think that's right?
No, absolutely. It is a personal thing, but in my experience, people are open to it.
Okay, fab. Thanks for your question, Pauline. You can submit questions at any time about anything we've discussed here today. You can do so by going to the questions tab of the GoToWebinar viewer window, or if you're on a smartphone or tablet, just look for the question mark icon and you can submit those at any time today. So our next question comes from Suzanne. She says, I prepare for my discussions and always take notes, but as soon as we start, all goes out the window and I just start blabbing. I don't do a good job of using the time and don't get the answers that I'm looking for, and Suzanne's finding it quite frustrating. What can she do?
Thank you, Suzanne. It can be emotional in consultations, depending on what topics you're discussing, and I think healthcare professionals do understand that. Perhaps some of the things that we've just recently discussed, taking some specific questions and handing those over at the beginning of the consultation, so that you're not having to verbalise them, and the consultant or the nurse can have them there in front of you. And try to respond for you. If you do get the opportunity, maybe privately with the nurse specialist, you might want to sort of explain that you do feel overwhelmed in the consultations, because I'm absolutely sure that your team will want to help you with that, and I'm sure your nurse would be open to having a discussion and looking at some maybe strategies that might work better for you.
And what about the role of family or friends or carers in this situation? Is that something that they might be able to help with?
Absolutely. Taking a family member or a friend along with you can be great and very supportive. And certainly, the healthcare professional will know that they have your permission because they'll be there with you. So they can even ask the questions on your behalf if you do find you become overwhelmed.
We're going to go to our next question now. This one comes from John. He says, I usually take my wife with me to appointments, but she can't always make it. Can I take someone else for support? How do I ask them? And it might sound strange, but it seems an awkward thing to ask.
Thank you, John. Yes, it's absolutely fine to take somebody else with you to appointments. From a healthcare professional point of view, they'd be very happy for you to have someone there to support you. When you say, how do I ask them, I'm assuming that you mean, how do you ask the other person that you want to invite? I think it's a very personal thing depending on your relationship with them. Perhaps if you're thinking they might not feel comfortable to come with you, you could consider speaking to them via email or dropping them a little note, and that way you can just say that you wondered if they might be willing to come with you and be a support on occasions when your wife can't come, but that you don't want them to feel obliged, or if they didn't feel they wanted to do that for whatever reason, some people don't like hospitals, for example, then that would give them a way of saying that it wasn't for them.
Okay, I hope that helps, John. I can imagine it can be a difficult conversation to have. If you do want to speak to someone at length about this, please get in touch on the info line. We'll be giving that number again at the end of the webinar. I think we've still got a good couple of questions left. If you are interested in submitting one, please feel free to do so at any time. You can do so on going to the viewer question tab of the GoToWebinar viewer window, and also if you're on a smartphone or tablet, remember to look for the question mark icon instead. So our next question comes from Stuart. He says, I changed haematologists recently, but I find my previous doctor much easier and better to talk to than my new one. Can I transfer care to a new doctor for that reason?
Okay, yes, I think it would be possible. Obviously, you would have to discuss that with your haematologist. I don't think that would, it depends on the reason that you changed haematologists initially, but I don't think that would strictly count as a second opinion. So I think maybe that might be something that might be easier to discuss with you if you were happy to call the info line, just because we could sort of chat through and understand the nuances of the situation to be able to advise you a bit more.
Yes, please get in touch, Stuart, if you want to give us any more information. We've also got the email address for Ask the Nurse, which also goes through to our specialist, so we'll be giving those once again at the end of the webinar. Okay, so This is another one of our questions. This comes from Andrew. He says, it was very useful to hear about second opinions. Do you think my healthcare team would feel I didn't trust them or believe them if I did ask for one?
Thank you, Andrew. I think it's a concern that a lot of patients have. But I don't think it's about trust. I think thinking through the reasons that you want your second opinion is important, and then speaking to your team about that. Myeloma is a complex disease, and it's very reasonable sometimes to want to get a second opinion, either for reassurance or to get additional information. And as I indicated in the presentation earlier, doctors nowadays are very used to collaborating and working together, and you may be surprised that when you discuss it with your doctor, they may also think that that's a good idea. So I hope that I have reassured you that doctors are open to this.
Okay, do you think second opinions is something that quite a lot of people feel quite apprehensive about asking, not wanting to cause a fuss almost?
Yeah, no, absolutely. I can understand why people have reservations, but in my experience when I was working clinically, people would ask for second opinions, and it wasn't ever an issue. But I think being clear in your own mind what you're hoping to achieve from a second opinion will help you have that discussion, because then you can articulate that to your doctor.
Okay, thanks very much, Debbie, and thank you, Andrew, for your question. I think that's all the questions we have time for today. We just wanted to apologise for our technical difficulties. Once again, we have been recording the webinar, so at any point if you didn't manage to hear what we were saying, we'll be sending out a link and we'll be able to get that information to you. If you do have any additional questions and you want to chat to Debbie or one of our other specialists after this session, you can call the Myeloma Info line. The number is 0800 980 3332, and you can also email our specialist on askthenurse@myeloma.org.uk. Thank you very much for joining us today. Once again, we really want to hear your feedback for this session, as well as all our other sessions that have been taking place in the Living Well with Myeloma series. So please get in touch and let us know what you think, and we hope to speak to you again soon. Thanks very much.